Hello everyone and welcome to my channel Story Insights. Today we are talking about a topic many people are curious about. Should a man drink a woman's breast milk? And what actually happens if he does? This topic is often surrounded by confusion, but the science behind it is simple and clear. First, breast milk is naturally created for babies. It contains nutrients, antibodies, and protective elements designed to support infant growth. For adults, it is not harmful, but the nutritional value is not necessary for a grown body. The adult digestive system does not get any special benefits from breast milk the way a baby does. However, many couples explore this act because of emotional intimacy, curiosity, or a deeper sense of bonding. Psychologically, this act can increase closeness between partners. When a man drinks a woman's milk, the body releases oxytocin in both partners. Oxytocin is called the bonding hormone, and it increases emotional connection, trust, and comfort between partners. This is why some couples feel more connected after this experience. Another psychological factor is the feeling of care and nurturing. Some men associate this act with emotional warmth, comfort, and affection. This does not mean it is medically necessary, but it can affect the emotional side of the relationship in a positive way, depending on the couple's understanding. Now, let's talk about the physical effects. Breast milk is safe as long as the woman is healthy and not taking any medication that can pass into the milk. If the woman is using antibiotics, hormonal medicines, or any strong medication, then the milk should not be consumed because traces can enter the partner's body. So health and safety always come first. In terms of benefits, some people believe it increases immunity, but there is no strong scientific evidence that adult immunity improves from breast milk. The real effects are emotional, psychological, and relationship-based, not medical. And what about the negative side? If done gently and respectfully, there are usually no physical harms. Problems only arise if the woman experiences pain, discomfort, or nipple sensitivity. That's why communication is extremely important. Both partners must agree and feel comfortable. In simple words, drinking breast milk is an adult choice, not a medical requirement. It can increase bonding and emotional intimacy, but it does not provide special health benefits for adults. What truly matters is mutual understanding, comfort, and respect between partners.